We got a phone call on a Friday from Washington, D.C. that La Crosse, Wisconsin had declined the federal Hill-Burton funds. And we knew we were second for the money. We figured we had 3 years while they did their project. And we didn't have any land, we didn't have any architect, we didn't have anything.
Beloit Hospital was rather uniquely built with the rooms. Each room had 2 beds in it, and each of them faced a different direction, more or less.
In 1968, when you came into the emergency room, there was one nurse, and that nurse triaged you, diagnosed you, and then called the doctor on call who was at home. So we've gone from there to what we have now, and that's an incredible difference.
This is a place where a lot of people in the community go and get their medical care, and I feel like, at least what I hope, is that we do a good job of making sure that people know that we are invested, and we're invested in both our patients and in our community.
I've seen a lot of growth. I've seen a lot of new physicians start with the opening of North Point, the ambulatory surgery center, with the heart center. I've seen a lot of growth, and I kind of look forward to a lot more growth in the future.
I think the uniqueness of Beloit Hospital and Health System is that it is Beloit. We have the state line area, but it's still a very localized care concern and takes care of our own citizens, our neighbors.
I think it's a source of pride for the whole city to have their own hospital. It's certainly a focal point of this community.
But the reality is that the community understood the value of an independent health system in ways that most communities did not. And the way they rallied around, came together, provided support for this vision, and realized this vision is a real inspiration to other communities our size.
Beloit Health System has evolved and grown since we relocated from the Olympian Boulevard location to Hart Road nearly 50 years ago. As we get ready to celebrate 50 years at the heart of the community, it's important that we look back, honor and thank the individual founders of the health system for their commitment and their passion to provide the best care for our community. They understood the importance of a strong healthcare system to the success of the community. We are honored and humbled to carry on that tradition of excellence and legacy to provide the best care. They deserved it yesterday. You and your family deserve it today, tomorrow, for life.